Okay, so today we're going to get into the CAMS, which is complementary alternative medicines. It's a big part of this class. I'll lead us into the classes on Tai Chi and yoga and meditation and all that other stuff. Just going to get a brief introduction here, and then we'll get into for the following weeks. Our first big one is Tai Chi, which we'll do today, but let's kind of talk about CAMS, alternative meds, kind of in general first. People use alternative medicines more and more. This is kind of dated stuff. 34 billion in 2007. 2008, approximately 38% of adults over 18 use some form of CAMS. I would say it's even more now. CAMS are pretty wide-ranging. If you use trying to think of some different things that people may use for sleep and that sort of stuff. Melatonin, something as simple as melatonin or ginseng, whatever, biloba kind of stuff that's in a lot of drinks, energy drinks. A lot of that stuff is CAMS. Do patients communicate CAM use to their doctors? 30 to 60% of the time, physicians don't tell their doctors. They kind of receive to the doctor that will kind of look down on them. And this kind of comes down to us. I saw this a lot in home health where people are using CAMS in the home. And you have to kind of inform the team, inform the doctor, because they can interact with their regular medications. In some cases have some terrible side effects. So you have to be kind of proactive and trying to figure out if they're using CAMS or not. Different approaches to medicine kind of ties into CAMS, different ways of looking at medicine that we do probably so much in the West. Conventional Western medicine, that the MD, medical doctor, or the DO, osteopathic physician, or in most cases these days it's a nurse practitioner or a physician assistant that we see. What do they usually do is they give you the pills. They're very good on these. FDA approved pills, they diagnose and give you a pill or a technological test like an MRI or that sort of thing. That's kind of how Western medicine is based on diagnosis, medication, test, surgery kind of thing. Non-conventional medicine or Eastern medicine, Chinese medicine, very, very old, 2,500 years old. A lot of herbs, acupuncture, massages, different kinds of Tai Chi kind of exercises, dietary therapy, a different kind of approach to medicine. Ayurvedic medicine, this is India, based in India, kind of integrates the body and mind. Think of yoga. Yoga actually in India has a lot of spiritual components to it. Massage, meditation, again, herbs, that sort of thing. This is very, very old too. So the alternative kind of things, the CAMS kind of things, more into the herbs, different kinds of mind-body kind of approaches. CAMS terminology. This is from the NIH. NIH is National Institute of Health. Complementary medicine refers to the use of CAMS in addition to conventional medicine. So you're complementing the Western medicine. You're not just doing it by itself. It's a complement kind of thing. Alternative medicine refers to use of CAMS in place of conventional medicine. So you have cancer. A CAM approach would be radiation and yoga, and maybe herbs. An alternative medicine approach would be the CAM in place, totally the CAM. So you're going to go totally with herbs and yoga. Integrative medicine discusses specific practice medicine and combines CAMS and traditional medicine into one approach. So this is more a systematic kind of way. It's like the CAM approach, but it's more systematic, that they're kind of integrating the two. It's very similar to CAMS, they kind of blur it together. But it's more of a systematic kind of way of using a specific herb or a specific Western medicine to treat cancer, for example. Great resource, this NIH resource, National Institute for Center for Complementary and Alternative Medicine. Use this resource, remember this resource. You'll be going into homes, you'll be seeing clients, and they'll be taking all kinds of CAMS, and you'll wonder, is it pretty benign, which a lot of them are, or is it not so benign, and is it kind of worry about interactions? Is there evidence behind it? When I say evidence, academic kind of research evidence behind it, it's all right there. You can just look up the CAM and get the scoop on what it's all about. Categories of CAMs: natural products, mind and body stuff, manipulative kind of massage, chiropractic is a form of CAMs, I believe, body-based practice. We're going to break these down individually. Natural products, dietary supplements are distinguished from prescriptive drugs by virtue of being available without a prescription, and unlike over-the-counter meds, they are legally considered dietary supplements rather than drugs. A lot of the supplements that you see, like if you go into a alternative or herbal medicine kind of place, they'll have a lot of stuff that you can get. A lot of it is FDA approved in terms of a food to do things. They aren't approved as a drug to reduce blood pressure, so to speak. Distinction eliminates the need for proof of efficacy. They don't have to prove that they reduce blood pressure, unlike like lisinopril or something. And safety prior to marketing also places the burden of proof on the FDA to prove that a supplement is not safe. So they don't have that scrutiny behind it through the FDA, which doesn't mean they don't do things. I mean, because they can be just as powerful of a drug, in some cases very effective, like a functional medicine, which is an MD will use a lot of these products that don't have so much research behind them. But they vary a lot. It's kind of like the Wild West. You have to kind of really go to that site and do some research on it. Mind and body, meditation, yoga, acupuncture, deep breathing, hypnotherapy, tai chi, progressive relaxation. These are all kinds of forms of that. They're grounded in traditional Chinese medicine and the Ayurvedic, which is the Indian kind of medicine, Indian medicine. It aims to integrate the whole body, mind, and spirit to prevent and treat disease. Therapies include herbs, massage, and kind of yoga. Many of these mind-body things, in our Western interpretation, we kind of lost the spiritual kind of part to it, but like the Tai Chi, the yoga, they are a form of a religion, organized religion in a lot of cases. Activities that are placed in category can also be considered spiritual rather than just being mind-body. Some consider it more accurate to phrase them mind-body-spirit. Integrative health considers the dynamic between mind, body, spirit, and community. Contemplative practice, mind-body contemplative practice. Historically, contemplative practice has been taught by the world's spiritual traditions. However, in the last 3 decades, the fields of psychology, medicine, and education recognize that contemplative practice contribute to well-being and maturation. This is some great examples of the contemplative stuff. We do a lot of this stuff. Meditation, music, I think journaling is on here, yoga, dance, Qigong, Tai Chi, retreats, journaling, contemplative arts, visualization, a lot of stuff that's very, very mainstream. A lot of practitioners, occupational therapists use a lot of this sort of stuff. Contemplative practice can help develop greater empathy and communication skills, reduce stress, enhance creativity, spread a loving and compassionate approach to life. It's focused on the pursuit of meaning, purpose, and values. Different kinds of mind-body practices, spinal mobilization, massage therapy, other CAMS practices, Feldenkrais, you may hear about that. A lot of physical therapists are into that. It's a great kind of movement method. It's good for people with issues around mobility, movement, from children to adults, Pilates, Rolfing, energy healers, all these different kinds of stuff. This is IOTA's approach or statement on it. IOTA asserts that CAMS may be used responsibly as part of a comprehensive approach to enhance engagement in occupation by people. So it's okay. This is what we do. It's part of our approach. Organizations and populations to promote their health and participation in health. OT practitioners may utilize CAMS in delivery of occupational services when they are used as preparatory methods or as purposeful activities to facilitate the ability of clients to engage in daily life occupations. So, first, is it safe to use? You always make sure it's safe. Second, do you know what you're doing? Have you had training in it? This training may be a workshop, certification. you may have learned on the job from a fellow practitioner, but you have that knowledge base and you know first and foremost what you're doing is not hurting. And your goal, as always, as an OT is to improve their ability to do whatever it is they want to be able to do, their activity level, their occupation. CAM approaches have been utilized in occupational therapy for several years, include but not limited to guided imagery. Therapists use it all the time. Massage, myofascial leash, that's a CAM, meditation, behavioral relaxation training, yoga, tai chi, mindfulness. Some of these things we're going to really get into in these coming weeks. The OT practitioner must determine whether the use of CAM is consistent with the client's cultural practices, priorities, and needs, is safe to use, and is an appropriate approach to facilitate the ability to participate in those occupations.